Good afternoon. Thank you for attending our presentation so you can listen to us talk a lot about our interdisciplinary and interprofessional collaboration. Our title is Promotion of Digital Citizenship with Simulation-Based Learning for Social Work and Nursing Students at Stony Brook University. Our presenters are Jeanette Lukas, LMSW, Clinical Assistant Professor, Practicum Education Coordinator, Stony Brook University School of Social Welfare. Erin Zazzera, Master's in Public Health, Registered Nurse, Clinical Assistant Professor, Stony Brook University School of Nursing. Dina Pilgrim, LMSW, Assistant Director of Practicum Education, Clinical Associate Professor, Stony Brook University School of Social Welfare. And Hyacinth Spence, LMSW, Clinical Associate Professor, Stony Brook University School of Social Welfare. So the objectives of this presentation are 4, and by the end of the session, we would like you to have a practical understanding of the application of Kolb's experiential learning theory. It's a 4-stage cycle for implementation. We'd like you to have a working definition of interprofessional education. We would like to talk about the benefits of simulation-based learning and experiential learning models, what we've learned, and we want to further expand on simulations to increase digital access and technological advancements in virtual reality simulations. So as always, we want to start with a framework. Dr. David Kolb developed a theory outlining 4 distinct learning styles based on a 4-stage learning cycle. The first cycle is experiencing, right? So from the moment of birth, individuals begin learning from their life's experiences. The first stage involves experiencing the situation, the world, and serving as a gateway to learning. Thinking about your 5 senses, utilizing your 5 senses to understand the world around you. The second stage of the cycle is reflecting, where learners begin to analyze and understand key aspects of their experiences, laying the groundwork for further learning. Following reflection is your 3rd stage, and that is thinking, where learners critically analyze and solidify concepts, actions, and their capacity to learn from their experiences. And then finally, the last stage is acting. This stage empowers learners to actively engage with their newfound understanding, integrating it into their own actions and decisions. And then, of course, the cycle begins again with every new learning experience. Dr. Kolb's cycle of learning, experiential learning, emphasizes the importance that learning is ongoing and evolving.
So next, we're going to talk about the importance of interprofessional education and what it actually means. And the World Health Organization identifies interprofessional education as when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. Ultimately, that should be our goal for every client and patient we meet with, is to improve their health outcomes. So far too often within education, you're seeing that professions are siloed, and nurses are working within the nurse profession, medical doctors are working within medical field or medicine field. Social workers are universal and kind of go across everywhere, but far too often we are siloed, and this is a disservice to our patients. This is why we need to improve our education system and including these interprofessional educational opportunities so our students learn how to best meet the needs of their clients and patients and meet their health outcomes even further. Next slide. So we go into our IPEC core competencies. These are developed by the Interprofessional Education Collaborative, and they were just recently updated in 2023. So there's 4 core competencies, and these are all based on the health of a person and population, and realizing this is a continuum of care model. This is not something that is linear. This is circular. We're always working to improve and enhance these competencies as we develop further learning opportunities. So we start with values and ethics. That's the work with team members to maintain a climate of shared values, ethical conduct, and mutual respect. when you look at the values and ethics across professions, there are a lot of similarities across them. And the values that nursing holds are the same values ultimately that social work holds. So these should be universal. We should be able to maintain each other's values and ethics while we're working together as a profession. Next is our roles and responsibilities. So this is the use the knowledge of one's own role and team members' expertise to address individual and population health outcomes. It is important that we identify what our role is and that patients clearly understand who does what and how we do it so that we can best serve the needs of our clients. While if something's coming up and I'm a social worker and I'm talking with a patient, let's say the patient says they need something medically, I am not going to be the person that they go to, but they may be coming to me because I'm the person that's in the room. So I need to know whose role that is and whose responsibility so I can best direct the patient. Communication is at the forefront of everything we do. Communication in a responsive and respectful manner. Understanding that each team member brings their own voice to the team and the welfare of that patient. So we need to understand how to communicate better, how to be respectful of each other in that communication and understanding of our roles and values. Teams and teamwork, applying values and principles to the science of teamwork, and understanding that we all come with a variety of strengths and skills, and each one of them should enhance each other. Some of the changes that happened with IPEC this year, it's a One Health model. So everybody is within the same team working with the same patient. So it is all about One Health. We're here to provide one person with their health, and we need to do that as in a unified effort. Social justice and health equity is a major focus with the changes. Cultural humility and the value of diversity in your teammates, in your collaborations. Diversity is very important. Patient outcomes linked to team members' ability to demonstrate the following to patients: honesty, integrity, respect, ethics, team culture that values equity, justice, diversity, and inclusion, empathy and compassion, and shared decision-making. This, when we're so siloed in our professions, we're not really sharing the perspectives of everyone to really have this combined treatment plan and treatment outcome for better health outcomes for our patients. Next.
So the objectives for our interdisciplinary simulation were a little bit different for the School of Nursing and the School of Social Welfare. So I will speak for the School of Nursing. So for our students, this was our population health nursing course. They were senior nursing students. And what was different about this simulation was we were moving them from the typical inpatient environment to now we were talking about simulations in the home environment. So for population health, we talk about the care of people in the community, and the population in this case was going to be the population of the patient with their family in their home. And so we'll see on the next slide, we'll talk a little bit about the scenarios that we chose. But for us, for the School of Nursing, our objectives were focused on not only hands-on practical nursing care, but also the psychosocial aspect of caring for a patient at home with their support and their family alongside of them. So some of the hands-on practical nursing objectives that we wanted to incorporate was medication reconciliation and symptom management. So those two are paired very closely together. The scenarios we chose were patients who were recently discharged from the hospital, which is a very typical common scenario. And so we were training our student nurses to look at the discharge orders from the team, make sure the patient had all the medications at home, had an understanding of how they were supposed to take them, any side effects, and what type of symptoms that these medications were being used for. We also looked at things like hazards in the home, falls prevention. So our students had learned that quite a bit, especially in the acute care inpatient environment. And now, again, we were moving them into the home where people spend the majority of their time to kind of look around as a home care nurse and talk about and educate the family about different ways that we can make the home environment safer for them. The other thing that we wanted to focus on was infection control in the home. We're so used to the inpatient environment for our students. Now we were moving into the home environment. We wanted to make sure we weren't introducing any type of pathogens into the home and make sure we weren't leaving with any as well to go on to the next home. So those were some of the hands-on practical things. In addition to that, we wanted them to focus on psychosocial aspects in the home. And this is really where the scenarios that we picked, having social work in the scenarios with them was really a wonderful part of it. We talk as nursing students about assessing the psychosocial needs of the patient and the family, therapeutic communication, and at times these kind of patient issues are so involved that we would certainly say this is when you would get social work involved, and having them in the room with us, with their faculty and their students, to then kind of take over and show us and our students what their assessment looks like, what kind of resources in the community they're going to call onto. That was really the wonderful thing. But those were our objectives for the School of Nursing. And I'll hand it off to my colleague in the School of Social Welfare to talk about their objectives.
Good afternoon, I'm Hyacinth Spence, and my part of this presentation is going to be talking about nursing, how nursing and social work intersect to work with the patient in the home. So a part of what we were doing, working with nursing, is identifying the psychosocial aspect of what nursing does and what social work does, and how we could better serve our patients. We focus a lot on the competencies, and competency number one, we talk about ethical and professional behavior and utilizing the competencies in terms of how to work and focus on our clients and in the home and what they do. When our clients go, when our students go in with nursing and they see what nursing does, nursing look back at social work to kind of get some of the communication down, working with the families and communicating with the doctors, case management and all. We focus on competency number 6, which is engage with individuals, families, group organization, applying knowledge of human behavior and the person and environment, as well as interprofessional conceptual framework to engage with clients and the constituents, use of empathy, reflection, and interpersonal skills to engage in culturally responsive practice. And we see where with nursing and social work, we intersect a lot, and sometimes we overlap in terms of what our services are. So for example, we use the psychosocial model also. We select 2 cases that nursing and social workers look at for the benefit of the client. And I will go in that later on. The other aspect of it demonstrate the ability to assist clients in acquisition of services. And nursing and social work, again, it's the same thing that we do in terms of the services that are needed. Social workers are looking at the psychosocial case management, making sure that they have the ability to interact with the families and who else or whoever is there, also looking at the environment and helping to make sure that the client is comfortable and that we will be able to help them age in place, stay in their homes, and get the services that they need. Competency number 9, we focus on practice with individual families, organization, and select and use culturally responsive methods for evaluation of outcomes. Critically analyze outcomes and apply evaluation findings to improve practice effectiveness with families, group, and organizations. the two cases that we selected, they are older adults who are living at home in different situations. One is living in a home where it's in-home hospice. The other one is in-home medical. This client has a slew of medical issues that we really needed to, the student really need to collaborate with social work and nursing to make sure that everything is done. We look at both cases because they need a lot of case care, both from nursing and social work. The nursing students came in and they did their evaluation in terms of what the client need in terms of staying in home, helping them with their medication management, helping them with doctors, speaking to doctors. The social workers, they focus a lot on the environment. They focused on the collaboration with home health care, doctors, and family members to help them to, in helping them to be able to stay at home. The services, and this help our students, undergraduate students who are ready for their senior practicum in the community. This gives them a psychosocial base in terms of what home care is about. How do they navigate all these, how do they navigate the waters in terms of home visits, what they do when they go out. The graduate students who are doing these simulation-based courses, it helps them because when they are going on to their next practicum experiences, it helps them to be able to work effectively with their clients.
Yes, I would agree with you. Oh, can we just go back to the previous one, Dina, please? Just for on the nursing, the School of Nursing, and I would agree with you for the benefits for the undergraduate students. So we had developed both of these cases in conjunction with the School of Social Welfare, and they were both fairly complicated clients and family situations. This is kind of a snippet of the beginning of it. Really goes on to talk more about their symptoms and all of the questions that they had. There was some family conflicts as well with both of these cases. The case on the left, Carl, was an end-of-life hospice care situation, receiving hospice in the home, who's really struggling with pain. And so being able to, from the undergraduate nursing students' standpoint, identify what the most pressing issue was, and start to work with family about how to educate about symptoms and using pain medication correctly. And also our patient on the right, Brooke, had a very, complicated medical history as well. And as Hyacinth was saying as well, the social work students and the nursing students came together to really talk about these complicated psychosocial issues and what would be the best way to use the resources in the community. So you can go on to the next slide, please. So student feedback, we did feedback of both social work students and nursing students. It was overwhelmingly positive, which we were happy to hear. We asked them how satisfied they were with the simulation, how we ran the day, how the case studies were. And you could see a majority of the students found they were very satisfied with the day. We also asked them specifically about the interdisciplinary work. I know for the nursing students, this was the first time that they had done a simulation with social work at all. So they were really interested in asking questions to faculty and students about again, where their piece comes in and when would be the proper time to include social work. We talked quite a bit about teamwork in home care and how social work is part of the team, and nursing and chaplain and the medical physician and all these people that you really work together with in order to improve health and wellness in the home. So you can go on to the next slide. And we also asked them to include comments as well. So some of our student feedback, again, you can see on our screen, was very positive. They were happy to collaborate with students from some of the other health sciences schools that we have right here at Stony Brook. Again, it was a unique situation. And I'll pass it on to Jeanette, who's going to talk about it from the social workers student standpoint as well, from their feedback.
Thank you. Yes, the social worker students, it was an overwhelming sense of this is an amazing opportunity. We love learning from other professions and everybody together, and just how can we do more of these? And it's made us realize that we really do need to enhance our ability to offer these interprofessional education simulation-based learning opportunities for students to have the opportunity to communicate with other professions and learn about them before they're actually in practice. So it's something that we want to continue and keep promoting, and we plan to continue moving forward with. Next slide, please. That brings us to virtual reality simulation. Stony Brook University, we have a newly developed center for interprofessional innovation. And through that, I am part of their committee, and we are working on a virtual reality committee as well, where we're in the midst of testing out virtual reality simulations to see how we can enhance our simulation ability across professions. Because if you don't know much about virtual reality simulations, they offer enhanced learning and knowledge base. It's an immersive environment that students can really dive into in a safe way and get on-the-spot feedback, so that they're not only engaging with other professionals and patients and maybe patients' families, they're also learning how to do it in a safe manner while getting that on-the-spot feedback from their professors, to really build those critical thinking skills, and doing it in a safe way where it's not on our most vulnerable patients, as they do now in their practicums and clinical placements. So virtual reality is another way that we think we can enhance our simulation base, and really offered a wide variety of learning opportunities for students. Next slide, please. That brings us to digital citizenship and why it's so important when we're moving into the world of simulation-based learning within digital technology. And a few things that we want to keep in mind when developing this and offering this to students is the importance of digital etiquette, which is clearly outlining appropriate behaviors while using technology. So presenting yourself in a professional manner. And this also goes into digital communication, which is another key point of digital citizenship, where professionalism and being respectful of each other and allowing time for all voices to be heard, offering an understanding of differences, and coming at it in more of a humble fashion, where we're learning from each other and being respectful at the same time. Even if we may not agree with everything everybody's saying, that's still learning, and it's still valuable, and it's still part of the process. So how do we respect each other, learn from each other, and grow from each other is ultimately our goal in everywhere we go with simulation. And that's the end of our wonderful presentation. And if anybody would like to contact us, here are our contacts. And thank you all for listening.
That was fascinating. Thank you.
We're glad you enjoyed it. We're happy you were here.
I have a nursing background, so it hit home a little bit for me. So it's great. Thank you so much. I'm going to stop the recording.